Welcome to another episode of Cutting Edge Health. And today we're talking about hope for stroke survivors and the science behind spinal cord stimulation. If we haven't met, I'm Dr. Orlando Landrum. I'm a physician that helps patients understand how to be able to punch pain in the face and how to get back to leading the life that you deserve. Whether that pain is physical or mental, we don't care. We just know that you shouldn't have it. So how can we be able to do that without being reliant on drugs, surgery, or other invasive treatments that just don't work and aren't sustainable? Today, we're talking about stroke pain. And stroke can occur from a number of different reasons and rationales. And in terms of how it impacts people, it can be significant. And one of the things that we can see is when we take a look at data from the World Health Organization, it looks like the following. So a better close-up view looks kind of like this. And what we see is that there's about 12.2 million new strokes per year, or one every 3 seconds, which is significant in nature. What we also know is that it has an impact on people from a cost factor in 2017, which is a while or so ago, of 861 billion across the world. Stroke survivors in the world region, about 89% of global stroke deaths and disability combined to really impact low and middle income countries. And 1 in 4 people have a stroke in their lifetime. And that number has increased 50% over the last 17 years. So I bring up that topic so that people understand the significance of this. As a physician, and one of the reasons why I became a doc is both my parents had a stroke that was significant in nature and was debilitating to their ability to be able to be functional. So we know that this is something that's significant for a number of people. And we also know that it really can steal someone's feelings of hope. So what we want to talk about is a new type of technology that's out there, that's been there for a while, but utilized in this context is a little bit different. And there's a paper, and as you guys know, we always kind of go back to the research so that we can be able to really be able to assert that there's science behind what we're saying. We're not just making some type of like false claims. And there's a paper that was the epidural stimulation of cervical spinal cord stem for post-stroke upper limb paresis. And I know that that's a fancy terminology. It sounds fancy. It sounds like, oh, big deal, right? But at the end of the day, what it's basically saying is, can we use spinal cord stimulation like we've talked about before, where we place a lead inside the epidural space, and we utilize that to be able to help the inability to be able to move upper extremities. So not always paralysis, but certainly issues with being able to have normal movement. And this in particular looked at it in a couple of different ways, which are significant. But let me give you the authors of the paper so that way you have significance and understanding of what and who they are. So most of this was published in Pittsburgh, coming from Carnegie Mellon and Johns Hopkins. Those are the institutions that really are involved with this. And what they were looking at was how to be able to potentially impact patients, knowing that there's a fair amount of literature that has been utilizing the aspect of spinal cord stimulation in different ways from before. And what they were looking to do was to be able to recruit the aspect of nerves to stimulate the areas of the nerves that are important for motor, which is normally what spinal cord stimulation is not used for. As you read kind of this piece, it talks about traditionally what we're trying to do is to block pain signals. And what they've seen is by going further away from the center where we normally place the leads, somewhere near the dorsal root entry zone, which we've talked about before, we can get closer to the nerve fibers that are actually significant for motor. So what does that entail? What that entails is a number of different things. When we take a look at the patients that they were able to show that had stroke, what they saw was the following: as they saw patients that had these areas that were significant in terms of the placement and presence of how those impact of the lack of blood flow and blood flow impact was present. And so what we were able to see is that they clearly had major issues with how that brain functioning was influenced by that blood flow issue. What they did subsequently was to say, okay, well, maybe we can be able to kind of take a look and see how can we be able to impact the leads. And so what they were able to show is actually, if we go back over to the paper, it looks like the following, which is this. And so if we expand that just a little bit, so you can see that a little bit better, it looks like the following. So as we kind of expand this so you can see it, one of the things that they did is they looked at how to be able to connect and evaluate. As you can see, there's a lot of different things going on here with the aspect of the stimulator, how they're able to measure aspects of what's happening from a muscle standpoint. But when we scroll up, you can see this even a little bit better than what I had previously showed you. And what you can see as we kind of get into this is, one, the areas of where you had this areas that gave issue previously to where the insult was. And you can see in this area down in here, the spinal cord stimulator was placed. Now, a traditional stimulator is placed kind of in the midline, and that's where you use for pain. But you can see here, this one is off to the side. And that's kind of a key critical piece. And most people will be like, oh, yeah, it's off to the side. No big deal, right? No big deal. Well, it is a very big deal, right? So, and the reason why it's a very big deal is the following, is because those are the areas where those nerves sit that control our motor function, our ability to be able to use parts of our hands, our arms, to be able to use our legs, depending on where that lead happens to be placed. So when you take a look at that picture, you can see those leads are off to the side when you look at the top row. And that top row allows for us to then be able to say, hey, those leads placed there may be able to have some impact. And as you'd probably kind of gather, otherwise I wouldn't be talking about it, it did. And those are the things that are pretty interesting. So when we kind of scroll through and we take a look at like, what are some of those pieces that actually kind of fell into play, this is what we see. We see this plot that looks really kind of convoluted and crazy, but if you've been to the doc's office and you've heard them talk about dermatomes, what are dermatomes? Dermatomes are distribution of where you feel pain in particular, particularly according to a nerve root. So if a doc said, hey, you have a pain pattern that's similar to a C7 nerve root, they'll show you a distribution that goes down the arm. What some people will say is, hey, I have tingling down into my fingers. Sometimes they'll be able to kind of recognize this clinically is by having someone who falls off to sleep, and when they wake up or are awakened in the middle of the night, they have feeling that goes from their neck down their arm into their pinky or ring finger, and they have these tingling sensations which aren't pleasant, right? So that's a distribution that's typically pain oriented. This distribution is looking at muscular in terms of how can this be able to impact it. And so when you take a look at those blue structures that are highlighted here, you can see those muscles that are present, and the graphs both above and below represent the ability of being able to generate muscular intent and tension. And so what you're able to kind of see at the end of the day is that spinal cord stimulation was able to improve that ability to be able to recruit muscular activity, which is significant. And so when we say, hey, this person has a stroke, they're unable to move their arms. And if you heard one of our previous talk that talked about being able to use brain stimulation in a non-invasive way, that also may be able to improve this, as well as things like neurofeedback, which helps that patient be able to have a better brain-body connection. And now we could potentially use spinal cord stimulation. Now we're layering an armamentarium that's in place that allows for us to have an improvement, not only in function, but in someone's life. And so that's the significance of this paper and how impactful it could be to people as we start moving this technology further and further. The uniqueness of this is they were really intent on dorsal root ganglion. And in the cervical region, that has a lot of technical elements and potentially some trade-offs and side effects, which we won't go into in depth and detail. But the leads that were placed in this current study used traditional spinal cord stem leads, meaning they placed them the normal old school way that we've been doing it since the early 60s, and they're able to place this off to the side. Traditional DRG, which is through a certain company, has the lead come out onto the nerve root. And in the cervical region, that's a little bit more complex because there are other things that are in play. We're not even looking at that. We're looking at traditional stem leads that are placed there that can be utilized in a different fashion than what we had before in order to be able to punch pain in the face and get back to leading the life that you deserve. For those of you who follow our channel and you feel like this is something that you want to continue to have us talk about, topics that explore how can we be able to address physical and mental pain in a different way, please let me know in the comments about things that we can do to tweak this a little bit better. For those of you who know someone who's had a stroke problem issue, whether it's been both physical as well as potentially mental depression that's associated with the inability to be able to function, or even pain that's associated with it, because many times stroke can impact different parts of the brain, like the thalamus, that's actually key and critical in how we interpret and perceive pain. And this is something that you're like, hey, we need for you to talk more about this. Let us know. Really appreciate you joining us. And if there's other things that you want us to talk about, let us know that too. And we hope to have you join us on a different day. Thank you so much and have a great day.